Samaritan has really had a growing culture of wellness over the last few years that I really think began with the tobacco-free campus policy.
We, of course, had been tobacco-free inside our facilities for years and years and years, but had not extended that policy to apply to our grounds, our common space, and even to cars in parking lots. We have chosen to have the no tobacco policy apply in all of those areas. One of the things that we knew that made us feel very comfortable with making this change is that we did do a survey of our employees several months before the policy went into effect. And what we found was that well over 90% were in support of this new policy of going tobacco-free across the campus. That really made us feel good about the decision.
So there was a lot of interest after the tobacco cessation policy took off to do something else. And one of the ideas we had was to develop a program to improve the nutrition in our cafeterias and the choices that employees make when they go to our cafeterias for breakfast, lunch, dinner, or a snack.
The Carrot program at our hospital is a nutrition program in our cafeteria. Individuals who purchase Carrot items in our cafeteria get a 20% discount. And the Carrot items follow some nutrition guidelines to help our customers and employees make healthier choices in our cafeteria. And it's very easy to select the Carrot items because it's on our menu. So it's not, they're not having to read nutrition labels. They're not having to figure out what the guidelines are, what the healthy food is. It's just, here's the Carrot item. If I pick this, then I get a discount.
Sam Fit incorporates two different models, a fitness center model, 24 hours a day, 7-day-a-week access, with a wellness model of health risk assessments, health coaching, and health education.
Now our Sam Fit model is really probably the optimal approach to trying to influence healthy outcomes, in that now we actually have the location that we can apply the theory to. So we can take the concepts and say, okay, if you actually work out this many times per week, and if you change your lifestyles, what does that really do for you and do for the organization in terms of lowering costs? We pushed aside any kind of membership fee and said, so we had a low cost of entry into it as best we could, and we created some immediate feedback loops to the person that's enrolled here, so they know, how am I doing?
We had various predictions of our membership volume, our engagement, and our success level, and we have surpassed our expectations, our annual expectations, in the first quarter.
Our leadership bought into the concept and practiced it ourselves. So as you got the leaders more engaged in fitness and wellness and working out and nutrition and lifestyle and so forth, it was more transferable to our workforce at large. And then from that, we could see some benefit coming back to us, and again, decided to kind of incrementally continue to invest in it. If we do find ways that can lower healthcare costs through improved health status, population health, if you will, and we can apply those strategies across the continuum, we should see an overall reduction in healthcare costs. So it's a good chance for us to measure, does it really make a difference, or do we just think it makes a difference? But I think we're going to find out it does.